cartilages and muscles of the larynx and the pharynx. From which bronchial arch are they developing? Shoot your answer, doctor. Yeah. Give a bold answer for this question. Shoaib Bhagat is proposing 4th and 3rd. 4th and 3rd. And I am seeing 4th and 6th. Very good. Gangadeep is still saying 3rd and 4th. Very good, very good. 4th and 6th bronchial arch. You should not forget. So, doctor, first arch is trigeminal nerve and second arch is facial nerve. Third is glossopharyngeal. 4th to 6th is laryngeal branches of the vagus nerve. And cricoid cartilage is 4th to 6th. And horns of the hyoid and thyroid are from the 3rd. And stapes is from the 2nd. So don't forget this table. Bronchial arch derivatives is a favorite area. Now doctor, between superior constrictor and the middle constrictor, what is that which is running between the two? Let me see how good you are. One strong answer. Between the superior and the middle constrictor. I am listening stylopharyngeus and glossopharyngeal by Praveen and Saroj, Vishal also, Cherry also, Cosmita also. You guys are all becoming a ring where you are carefully thinking, let others answer. Yes, stylopharyngeus and glossopharyngeal. Typically, the glossopharyngeal nerve crosses the stylopharyngeus and it typically passes between the superior and middle constrictor. So don't forget, doctor, above the superior pharyngeal you have auditory tube, levator palatii and ascending palatine artery. Between superior middle you have stylopharyngeus and glossopharyngeal. Middle and inferior you have the inferior laryngeal branch of the superior laryngeal nerve and the superior laryngeal artery and superior thyroid artery. Below the inferior constrictor you have inferior laryngeal nerve and inferior laryngeal artery is what you have to remember at least until your entrance exam, right? Now, what is that nerve that supplies circumvallate papillae of the tongue? Shoot your answer, doctor. Come on, be bold and shoot, whatever be your answer. Excellent. Cosmita, Karki, Priya, Abhi, Pappi, everyone is saying glossopharyngeal, proud of you. So, anteriorly it is the chorda tympani, the branch of the facial nerve that provides the sensation of taste. Then, the sensation of the tongue is carried by the lingual nerve, the branch of the trigeminal. Taste is different from sensory touch. If you touch the tongue, how will you know? Because of the lingual nerve. Posteriorly, kaise hota? Both the taste and also the touch are carried by glossopharyngeal nerve. And what is the other favorite question of the examiner? All intrinsic and the extrinsic muscles of the tongue are supplied by hypoglossal. What is the only exception to this? Please don't forget, definitely this question aane wala hai, palatoglossus. And palatoglossus is innervated by vagus nerve. Don't forget, favorite question. And the valate papillae are in the front of the sulcus terminalis and they contain the taste buds and it is a glossopharyngeal. Now comes, why there is a Donan effect? Shoot your answer. Donan effect क्यों होता है? Cations, proteins, anions, albumin. सोच के आंसर करो. Praveen Kumar says albumin. Shibanu says proteins. Manoj Thakur says proteins. Right. Not just the albumin, but the proteins. Absolutely right. There are more proteins in the plasma than the interstitial fluid. There is a Donan effect where ions move across the capillary wall. Abhi ye batao yaar. Easy question. Latch mechanism with a slow sustained contraction. Where do you see a latch mechanism? You have to shoot fast. Goswami says fast skeletal muscle. Come on, Goswami. Then Guru Shravan clean ball. It is not skeletal muscle. Isha Garg also clean ball. It is the smooth muscles, doctor. Smooth muscles. There is a prolonged holding of the smooth muscle contraction with little use of the energy and any little excitatory signal that will enable smooth muscles to develop. Prolonged tonic contraction is what you need to remember. Abhi aa gaya. Number wala question. You are going to answer strongly. Reynolds number above what value? Turbulence is found in arterial blood. Let me see how many of you rightly answered. Remember the number. Vishal Kumar bets on 3000. Daskatis. Bolo. Yes. I am finding A, B, C, all answers. D also. 2000, doctor. You remember, laminar flow is less than 2000. More than 4000 is turbulent flow. 2 to 4000 is unstable flow. Turbulence is encountered even in a straight blood vessel. Oh, sorry. Answer should be more than 4000. More than 4000. C should be the answer, right? Sorry, a small correction. Yeah. Now, increased blood pressure and tachycardia. What is the reflex which is involved? It is an easy question. Yes. Nagabhumi proposes Bajol Jarisk? No. Shaurabh proposes Cushing? No. Kosmita Karki proposes Cushing? No. Yes. Very good, very good. Bainbridge Reflux. Whenever the right atrial pressure increases, right atrium may what empties into right atrium? Superior vena cava, inferior vena cava and all this empty into right atrium. If you are giving too much of IV fluids to the patient, then the right atrial pressure increase and that will accelerate the heart because of the stimulation of the stretch receptors in atria. That is called the Bainbridge reflex is what you need to remember. Out of all these factors, the oxygen carrying capacity of the blood, it is most affected by which factor is a very, very important question. Shoot your answer, doctor. Yes. Avinash says hemoglobin. Bipesh is on pH. pH is do wrong but don't do blunder. Yeah, that's good. Hemoglobin is most important thing that affects. The cold temperature regulation, the cold center is controlled by which part of the hypothalamus? Which is the heat center, radiator, and which is the cold center in the thalamus, hypothalamus. Yes. I am seeing B versus C versus A rarely by Gangadhi. It is the posterior hypothalamus. Where do you feel shivering when you are cold? In the spine, no? So, let us quickly run through some of the important nuclei of the thalamus. Very painful thing to remember. VPL, remember it has a very painful leg. So, the nucleus has an input from the spinothalamic tract, medial lemniscus, so lower limbs and upper limbs, and the pain and temperature, all that will go to the VPL nucleus. BPM, you can remember very painful mouth. It has an input from the trigeminal and the gustatory pathway, taste. That all goes to the ventro-posteromedial nucleus. Then lateral geniculate, medial geniculate among the thalamic nuclei, what is their function? If you look at your nose, I mean your eyes versus ears. which is medial, eyes are medial. So vision is controlled by lateral geniculate and audition is controlled by the medial geniculate, the crisscross, which you need to remember. Similarly, inferior colliculus is with your audition, superior colliculus sees, vision is superior colliculus. Then if you look at the regulation of body temperature in the hypothalamus, you have a heat loss center, heat gain center. So in the preoptic nucleus of the anterior hypothalamus, you have the heat loss center. So they lead to cutaneous vasodilatation. Then heat gain, that is heat production center. It is located in the posterior hypothalamic nucleus, is what you need to remember. इसलिए shivering पीछे से होता है, posterior hypothalamic nucleus. Out of all this, which is the one that uses cyclic AMP as a second messenger? Should it, doctor? Should it? Yes. Cyclic AMP as a second messenger. So please write some good compliments about UMedico app in the Google Play Store. It means a lot for us. Yesterday, 1,000 students played quiz on the UMedico app. I am very happy, very, very happy, right? So I want every day around 50,000 students playing about 500,000 quizzes every day. The more and more and more you play, artificial intelligence can enable analysis of you and help you in your preparation, right? So please pray at least 10-20 quizzes every day on the UMedico app. You go to a topic, there are about 650 high yield topics. You have got 650 icons appearing on the UMedico app. You click on the icon, it will ask you to start play solo or with some other competitor you want to invite. So you keep playing until you get 8 out of 10 score. The moment you get it, forget about that topic. You go to the topics, to the other topics. So that is what you need to do. At least 20-25 games quizzes you should play every day and see how is your performance, right? So let's take up the next question. Good. I am seeing B versus D, multiple answers. Calcitonin. So for what all the camp is a second messenger. One way to remember is beta camp, glue, lubricate so many thyroids. Useless. One, because it's very difficult to remember, but at least you remember this. Beta agonist, C means CRH, calcitonin, HCG. Then alpha agonist, ACTH, ADH, MSH, PTH, glucagon, LH, somatostatin, TSH. They all use the cyclic AMP. Someday you have to set up a reminder on the UMedico app to remind you regularly. Another dirty question I wanted to disgust you a little bit. I am asking this question. Migrating motor complexes. What is the time which is required? Motilin is a very important mediator of this. Kriya, lucky number is 150. Naresh Kumar ka 100. Ritu Raj ka bhi 100. Very good. Mera number aayega. 100 minutes is what you need to remember. This is a favorite question of examiner, doctor. Out of all this, which is not a appetite suppressant. Ditto question agar NEET mein aaye to bhi, there is no surprise. What is your answer? Which is not, please mention the question number. Question number. Not an appetite suppressant. Very good. I am seeing Gerlin or Giherlin, what you call it as. Gerlin for sure, eh? Okay. Agar utna sure hai to we have to agree. Yeah. So you have a peptide Y, cholecystokinin and insulin. They suppress further feeding fundamentally. Ghrelin is released by the stomach, very important. And During the fasting it becomes released and it stimulates the appetite. Leptin is typically produced by the fat cells and it inhibits the food intake. Now comes the next question. This is a simple but a high mortality question I am asking. Let me see. Yes. Which of the following are absorbed in the colon? Kriya says short chain fatty acids. Arsad proposes medium chain. Anything else? Anything else? Gangadeep says long chain. Come on, clean bowl, Ganga. Short chain fatty acids are produced in the colon and absorbed from it is what you need to remember. Which cells in the duodenum produce the secretin? Easy question. Quick answer. Yes. Secretin. Kushbu proposes S cells. Absolutely. Not I cells. Come on. Always questions are very simple. Doing a wild imagination only take us to a wrong path. S cell.